confirmation of 2 jabs, and potentially that means that we can, straight off the amber list, we don't have to quarantine. When is that going to happen?
Well, this hasn't been clinically advised yet. We're working on it, and we're working on plans to essentially allow the vaccine to bring back some of the freedoms that have had to be restricted to keep people safe. I mean, after all, that's the whole purpose of the vaccination program. It's why it's so important that every adult goes out and gets the jab, and if you've had 1 jab, that you go and get 2, because that's where the full protection comes from.
OK, working on it. Does that mean potentially by August, so at least people might be able to have some semblance of a family foreign holiday this year?
Well, we'll get there when it's safe to do so. We want to do this right. We want to do this carefully and properly. But of course, we do want to get those freedoms back. That's the whole point of the vaccination program. So when I'm in a position to be able to say something more concrete, then we will do. But it is absolutely something we're working on. It's something I want to see.
Presently costing something like £600 million a day to the economy. So every day counts.
Well, yes, but the pandemic here at home has huge costs in terms of lives, in terms of the economy. And so protecting this country from what can happen, the variants we've seen around the world, that is a very, very important part of managing this pandemic. Now, thankfully, because of the vaccination program, we've been able to free up a huge number of the restrictions here at home. We're on track to deliver the step 4, the further openings, on the 19th of July, which is good. But we're also looking to see how we can replace the protections that are currently there with the restrictions, with protections that come from the vaccine, with respect to international travel as well. But it is more difficult freeing up international travel. We have one of the tightest border control systems in the world, and we have that because we want to protect this amazing progress we've made at home with the vaccination program.
OK, perhaps one option will be the new app that you want to talk to us about. Could that act as a vaccine passport?
Well, we can now, all of us, see our vaccine status, see your testing status on the NHS app. And we've seen this massive uptake of the NHS app. And there's 2. The one that you use to check into venues, 25 million people have downloaded that. A smaller number, 6 million people, have now downloaded the main NHS app, and on that you can show whether you've had the jabs. And it's important because we know other countries are going to say that they want proof that you've been vaccinated before you go. So when travel is opened up, we are going to make sure people have got that ability to prove it. So if you go into the App Store right now, Kay, you can download the NHS app. It connects up with your GP records. It means that you're more in control of your health data, which is important, and one of the big learnings from the pandemic, one of the things that we're strengthening with the data strategy we're setting out today. But it will also mean that you can see your vaccination status and see any tests you've done recently, to be able to help prove that you haven't got the coronavirus. So it's all part of using modern technology to help to manage this pandemic as well as possible.
OK, yep, I do that, and I can see that I've had both vaccines. I've had that app for a long time. I'm seeing that as a vaccine passport for me to be able to prove to other nations, if I travel overseas, that I've had both my jabs and I'm 100% invincible. Talk to me about Dido Harding, if you would. She wants to run the National Health Service, and I believe that you are keen on her doing that. Just looking at her track record, it's not great, though, is it? Track and trace, not fantastic, as my viewers will know. Her roles at Talk Talk and Woolworths weren't ringing endorsements for her career. Why do you think she would be a good leader of the NHS?
Well, I'm absolutely not going to get into any individuals who put their name forward. We have an open competition for who is going to be the next chief executive of the NHS. It's an incredibly important job, running, one of the most important institutions in the country, probably the most loved. And so we're looking broadly, and we've invited applications from across the board for who can do that job. It's a tough job, and Sir Simon Stevens has done it very well over the past 8 years. but we need to make sure that the NHS has the right leader, and we need to make sure that the NHS looks forward. And the data strategy, for instance, we're publishing today from the NHS is all about how we can harness modern technology to make sure the care you receive is better, because anybody who's used the NHS will have had the experience of going in and having to give their information over and over again. And make sure that we can organise the NHS as well as possible using modern technology. So the NHS does need
about Dido Harding,
to look forward.
My question is about Dido Harding. Why is she a good candidate?
Well, as I said, we'll look at all of the candidates who put their names forward, and I haven't seen the shortlist. The whole process is being run by the NHS board, and we're being very thorough. We've invited applications from right across the world.
Okay. Talk to me about social care. We heard from your predecessor, Jeremy Hunt, in the Daily Mail yesterday. He says it's a do or die moment, really. And we heard that from the Prime Minister 2 years ago on the doorstep of Number 10. You had a meeting planned with the Prime Minister and the Chancellor to talk about the social care crisis. Why has it been postponed?
Well, the Prime Minister's been absolutely clear that we're going to publish the plan for the future of social care this year. Our commitment is there in the manifesto to deliver on social care in this Parliament, and we deliver on our commitments, right? We were elected to get Brexit done, and we delivered on that. We said we'd protect the NHS through the pandemic, and we've delivered on that. We're currently delivering millions and millions and millions of vaccines every week. And we've committed to making sure every adult can get a jab. We've delivered on that, so we will deliver on social care. In terms of the ins and outs of the the internal processes, of course I'm not going to get into that. But what your viewers can rest assured is that we will deliver the plan for the reform of social care that, as you said in the question, is long overdue.
OK, we only have a limited amount of time. My question is, why was the meeting postponed?
Well, what I'm telling you, Kay, is I'm absolutely not going to get into diary management issues. What I'm going to tell you about is the commitments that we have to deliver.
Given how important it is, when's it been rescheduled for?
Well, you wouldn't possibly expect me to answer questions about private meetings, and I'm not going to. But what I am going to do is deliver the reform of social care that people want to see. Naturally, we had to delay this work because of the pandemic.
Why not? You said it's long overdue. Why are you not telling us when the meetings are going to be, when you're going to discuss with the Prime Minister and the Chancellor of the Exchequer, when something that was promised 2 years ago, a meeting has been postponed? You can't tell us when it's been rescheduled for. Meantime, something like, I think I'm right in saying, 18,000 pensioners a week are finding themselves in a position where they're being moved from hospital to social care, and they don't know whether they're going to lose their houses because the Prime Minister's not delivered on his promise of dealing with social care.
Well, I don't know where to start with the total rubbish in that question, Kay. Firstly, I'm absolutely not going to get into diary management. I talk to the Prime Minister every single day, and we're working very closely together on the delivery of this policy. But the second thing is, we absolutely were working on the plan before the pandemic struck, but you'll understand, and your viewers will undoubtedly understand, that when the pandemic struck, it was all hands on deck to protect lives and to get us out of this as fast as possible. And the vaccine is doing that, and the Prime Minister has committed to delivering this plan before the end of the year, and we're going to do that.
Hopefully, this isn't as rubbish a question then. Is the money there? Have you managed to have that conversation with the Chancellor?
Well, of course, the question in terms of social care is both in terms of how we can best make sure that people get the care that they need in the setting they need, whether that's in their own home with care coming into their own home, or, of course, in a care home, and in terms of how that's paid for and who pays for it. There are many injustices in the current system that we want to tackle, and that's one of the reasons this is such a complex piece of work, but it's also one of the reasons it's such an important piece of work, and we're absolutely determined to deliver on it, and we're going to deliver on it.
Okay, let's try this one. The Royal Yacht set to cost £200 million. That should we have that, or should we have that money to pay for 8,000 extra nurses for a year?
Yeah, well, I'm obviously not the minister responsible for the Royal Yacht, but what I can tell you is I think it's a brilliant idea. And it's a brilliant idea because it's how we can help to sell Britain abroad. And you only need to do encourage a small amount of trade in order to pay for a yacht like this over and over again. And by taking the yacht, essentially displaying Britain in countries around the world, in harbours around the world, from, New York to Singapore, you can sell what is great about this country and great to invest in this country. And we've got so much to sell. The middle part of the 21st century is a fantastic time for this country if we get this right. And I think that making the investment to be able to go and sell Britain around the world is money well spent, and I think it will repay itself over and over and over again. So although it's not my area, you can tell that I'm an enthusiast for this. And I think that it's long overdue, and I'm absolutely thrilled that we're making progress on delivering it, because I think it'll be great value for money in the narrow sense, but it's also very, very important that we sell Britain around the world.
Okay. Interestingly, Her Majesty is not a fan. So why don't you just call it a yacht?
Well, I don't think you know, and I certainly don't know of those opinions. But what I do know is that this country has a huge amount of opportunity. We've got to get through this pandemic and get out of it, of course, and we've got to build back and learn the lessons from it. But in terms of trading with the whole world, with all the trade deals that we're striking at the moment, we've got a huge amount of opportunity, and we've got to make the most of it.
Okay, I know you've got to go. Let me ask you very quickly before you do. The Italian Prime Minister wants to nab the Euro 2020 finals away from us because he says that we've got too many cases of COVID here in the UK. What would you say in response to him?
I think these Euros are going very well. The final's set to be at Wembley, and I was at Wembley on Friday night. It was great to hear the noise of the crowds again. And this is obviously something that Oliver Dowden, the Culture Secretary, is working closely with UEFA on. But I think we've got a great setup, and I hope that either England or Scotland or Wales, or potentially two, are in the final. That would be absolutely brilliant. It's great to see Wales through. It's great to see last night England are through, and maybe I hope Scotland can get through as well. That would be brilliant if all three got to the last 16. That would be an amazing performance for the home nations.
A diplomat and a politician to the end. It's always good to talk to you, Mr. Hancock. Thank you for joining us this morning.